Next on WNIN Newsmakers, we'll take a look at an instrumental treatment used in preventing fatal opioid overdoses. Naloxone is a medication that can reverse the effects of an opioid overdose within minutes of receiving it, and soon it will be made readily available over the counter by late summer. In an effort to reduce the chances of fatal opioid overdose and increase the access to this medication, the FDA approved naloxone, or Narcan, for the use of over-counter use in March of 2023. It can be difficult to determine when the administration of Narcan is necessary, so here to provide some insight on what Narcan is and how to administer it properly is Dr. Gina Hunke, an ER physician with Deaconess Hospital. Thank you so much for being here.
Thanks for having me today. I appreciate the opportunity.
Well, explain to us what exactly is Narcan and how exactly does it work to undo an overdose?
So naloxone, or Narcan, is actually an opioid antagonist. So think of your brain as a parking garage, and there are reserved spots. When we have an overdose, fentanyl or some other opioid is occupying all of those spots. And Narcan's actually like a tow truck. It comes along, it takes that Narcan or takes that opioid off of the parking spot and blocks it so that no other opioid can occupy that spot.
Oh, wow. That's fascinating. I love how you brought it down to the rest of us who can understand that a little bit better. And you know, when we talk about fentanyl, which can be very dangerous as well,
yes,
and very deadly, how does fentanyl kind of factor into this equation whenever it's been mixed in with so many of these drugs? Does that make it more likely to become a fatal overdose?
Well, actually, most fatal overdoses are mixed overdoses, meaning they're not just opioids, but they're typically mixed with either tranquilizers or benzodiazepines. And so Narcan, while it's very important, might not be able to counteract every single overdose because it only works against opioids.
So what are all the ways that Narcan can be administered to a patient? Because we're talking about this becoming accessible over the counter. So
yes.
How do you normally administer this, and are there new ways that they're coming up to make it more accessible?
So the administration over the counter will either probably be two ways. Most frequent is intranasal, and there's simply a little atomizer that you screw on the end of the syringe and you place it in someone's nose. It's very simple, it's very quick. The onset of action is just a couple of minutes, and you can re-administer the Narcan if that doesn't work, the first dose, every 2 to 3 minutes.
Okay.
Yes.
So what are some of the symptoms that we should look for? Because if I were to come upon someone, or if I have a family member that I am not aware of this situation, how would I even be able to determine that they are experiencing an overdose and that they need something like this?
So Narcan or naloxone should only be administered to someone who's not conscious and not breathing well. Do not administer to someone who's awake, even if you think they've ingested opioids recently, because that will put the victim into withdrawal symptoms.
Okay. And so you also mentioned that this is very quick acting. So
it is.
If you find someone that's unconscious and they're not breathing well and you administer this, how quickly does this work, and how do you then determine whether they need another dose or a repeat dose?
Right. So it works very quickly. If it's given intranasally, which will be the most common administration route, then it works in about 2 minutes. So what would happen if you administered the intranasal naloxone to a person who was the victim of an opioid overdose? They would typically wake up and start breathing again. So that's the end point. If that doesn't happen, then you should re-administer the Narcan every 2 to 3 minutes until EMS arrives.
All right. And is there kind of a cap on how many times you should do this? Because, if you're getting into this and you're continuing to have to administer,
Right.
at what point do you stop and say, no, you've got to stop doing this whenever you're a bystander just trying to, or a family member trying to help?
Your only cap really will be how much Narcan you actually have as a supply. Most people will only have 1 or 2 doses. You can't overdose someone using Narcan, and you really can't harm someone who's unconscious by giving them Narcan. So you can give them as much as you have and until you reach the desired effect or until EMS arrives.
So, if you come across someone or you've got a family member or a child or something like that and you suspect they've overdosed, how would I know that they've overdosed on opioids rather than benzodiazepines or some other drug to know that Narcan will be the solution?
You won't know.
Okay.
And so it won't hurt to give the Narcan to see if you get a response, but you won't know if you find an unconscious person who's not breathing well what overdose or even what medical condition is affecting them.
All right. And I think even from my own experience, I would be very nervous giving someone a drug or a medication that has been prescription in the past that
Right.
might affect them. Are there any side effects? Are there any dangers for someone administering a drug like this to someone else?
Don't be nervous to give it. You really can't harm a person. Sometimes what happens though, when the person wakes up who has suffered an opioid overdose, sometimes when you give the Narcan, when they wake up, they're agitated. So please be aware that that might happen. Be prepared. As soon as you administer the Narcan, go ahead and dial the phone and call 911 because you need help.
All right. And how quickly should someone do this? I mean, surely whenever you come upon someone, you don't have that right next to you or
Right.
readily available. Is time of the, definitely time of the essence? Is there kind of a window that this is going to work best, or is it just once you can get access to it?
As soon as you have access to it, give it. If a person's not breathing, then brain cells are dying. And the sooner you can reverse that, the better for the patient.
All right.
Yes.
That brings up a question for me. If they're shallow breathing or you don't
Yes.
think that they're breathing, how do you make the decision between rescue breaths and Narcan? Is it Narcan first and then potentially rescue breaths? Or, how would someone react in a situation like
Right.
that?
So we always ask that you check a pulse first. If the patient does not have a pulse, then start CPR. Hands only is fine for general lay public.
Okay.
Yes.
All right.
If you have Narcan, you can do that at the same time.
So is there any follow-up care that's recommended for someone who has been administered Narcan? Once they wake up, maybe they've settled down, the agitation is gone. What is the next step for them?
As soon as you administer Narcan, you should call 911. The reason is that a lot of the opioids that a patient might have overdosed on are actually longer acting than the Narcan. So the Narcan will wear off, and then the victim might go back and relapse into unconsciousness and difficulty breathing. So after you administer Narcan, even if the victim wakes up, call 911. They need to go to the hospital. They need to be checked.
All right. And so we hear a lot about Narcan being used to treat overdoses, and we think about it being a new thing, but how long has this been used?
It's not a new thing by any stretch of the imagination. It was invented in the early 60s, actually, and has been FDA approved for opioid overdose since 1971, I believe, by the FDA.
So, and what do you feel like has prompted this push now that we're hearing so much about it in terms of why Narcan is now part of the general conversation?
Right, we're seeing so many more overdoses, unfortunately. And the narcotics that are on the street market today are very potent. For example, fentanyl is 200 times more potent than morphine. Right, so they act very quickly, and we definitely need this reversal agent in the hands of people who can help victims immediately in order to make a difference.
All right. And just last question, but I think you may have addressed this already. Can Narcan be used for any other overdose, or is this only opioids?
It only is will reverse an opioid overdose. Okay. It's not going to be harmful if you give it to a person who's overdosed on other substances, but it won't reverse the effects of other substances.
All right. Well, Dr. Hunke, thank you so much for spending time with us and helping us understand this
situation.
Thank you.
We
appreciate it.
Appreciate the opportunity. Thanks so much.
Well, here to provide information on the local distribution of Narcan is Samantha Benty, who is on the board of the Evansville Recovery Alliance. Thanks so much for being here.
No problem, my pleasure.
So tell us, do you know some of the background on what prompted the decision to make this now available over the counter?
Well, we definitely are seeing, of course, as is national news, an uptick in the number of people that are overdosing in general. Our last available statistic, I believe, is from 2021, and we know over 100,000 people overdosed, and over 75,000 of those people overdosed on an opiate. And so making this tool available to community members is a key part in being able to interfere with those overdoses and keep as many people alive as we can. In the same way that we're putting AED machines into communities for heart attack, or the same way that we're teaching people CPR in general. So it's just a tool we can use as a public health intervention, and getting it into the hands of as many people as we can is key for that.
Well, and we've talked about actually making this available over the counter, but it's really been available without a doctor's prescription for a little bit longer than what we realize, right? Give us some of the background on that.
Sure. So in 2013, a young man in Indiana named Aaron Sims overdosed on heroin, and his mother believed that if he had had access to Narcan, if the people around him had access, then that would have been a preventable death. They were in a rural area, and we know that in rural areas, our EMS folks tend to be volunteer. The response times are different than we see in a more urban setting. And so she advocated for that availability to be made to folks that are just in the community. And in 2015, that legislation was signed into action. And then in 2016, a piece of amendment was added that made a blanket prescription available for anyone in Indiana to access and carry Narcan without a specific doctor's prescription. So there's a pretty quick turnaround from available with doctor's prescription to available to anyone.
Sure.
And we've seen a huge number. It's hard to track those reversals, of course, but we know that it's being used around the state and in our community as well. So Evansville Recovery Alliance has been distributing enthusiastically in our community free Narcan since 2019.
Okay. So how does this fit into the broader picture to address the opioid crisis? Because I know there might be some reticence that they say, oh, if you make this available, this just encourages people to continue to use these drugs because now they know that they can have a reversal immediately. So how do you address concerns like that? And what's the broader picture that this is just one piece of?
Sure. So, research has shown time and time again that that is not the case, that access to this does not change use habits in the same way that knowing my stroke risk does not prevent me from ordering a large French fry. Right. So, so we know that that's just not true, and that there's research that's done through harm reduction, which shows that that's not the case. And in harm reduction, our practice and our goal is perhaps eventual abstinence, but along the way, how can we make your use as safe as possible? And so this is preventing, people can't recover if they're dead. And so if the ultimate goal is recovery, we want to keep them alive to get to that point. And so how does it fit into a broader picture? Well, the more easily available this tool is, the more people we can save. We know that with fentanyl being present in most of the drugs that we're seeing in our communities, whether or not those intended drugs are opiate-based, we're seeing an increase in the number of Narcans needed to keep folks alive, to reverse that overdose. Oh, wow. We might have started with 2, and we're really recommending in a setting where we know people are using that there be 4 Narcan doses available.
Really?
Absolutely.
Okay.
So the intensity of those drugs is certainly changing. And so people may not be intending to intake a substance at the rate that they are.
Most definitely. So that was one of my other questions. If you're thinking about putting this in an emergency kit, or you want to have this at home or at a place of business, you might be thinking, oh, 1 dose is going to be fine. But really, what you're saying is you might want to consider multiple doses in making those
1
available.
dose is certainly better than nothing. If you can administer 1 dose and then call for emergency help, those emergency responders should also be carrying Narcan and can administer the next dose when they get there. In general, I would say 2 doses is good to have on your person if you're just hoping to maybe be that good Samaritan that can, help in a parking lot or help in a crisis situation. If you are in a situation where there are you know that opiates are being used, or you know there's a high level chance of that, I would recommend making sure there are 4 doses available, just for all bases to be covered. But again, if there's one could still make a huge difference.
Okay. Well, Dr. Hunke was telling us how this is not harmful to administer, so we can feel comfortable doing that. And you actually brought us some to take a look at.
Yeah.
So how about education or training? Is there anything available, or how would someone use something like this if they had
Narcan is so easy to use. We're looking at this. This is the intranasal Narcan. So this is administered through the nose. There are some intramuscular Narcans which are a little more elaborate, and that involves a syringe and injecting it into the muscle. Those, the intramuscular is perhaps more effective at reversing an overdose. It would require less doses, but of course it's cumbersome to carry around. It can feel questionable for people to be carrying needles. Law enforcement don't always understand how intramuscular Narcan works. That can cause some legal issues. So this intranasal is really, really easy to use. It's just this little guy here. It's got this red plunger. You would, to administer, put it in someone's nose and press the plunger. I could do this to myself right now and there would be no effect. The only thing that it has an effect on is the receptors in the brain that are experiencing the overdose. Hospitals routinely administer Narcan to people who they're not sure if they've had an overdose, or elderly folks where they're not sure what their dose tolerance is. So it's a very routinely used and very harmless drug to administer even if there's no issue happening. So the process is very similar, and every dose that we give out comes with a little instruction sheet, actually 2 of them, so that in case one makes more sense to you than the other, it's very, very easy to follow. But we can run through instructions in 20 seconds or less with people in a way that I think that they would be able to understand how to use. There are some additional steps that could be included, rescue breathing, for example. But the biggest thing we want people to know is tilt someone's head back, make sure they aren't in fact non-responsive, and you can do that by doing a sternum rub, taking your knuckles and running them right here. It hurts. So if you're just kind of passed out, or you can wake them. Generally, people will wake up with that.
They'd be like, what are you doing?
It's a really, it's a non-violent move, but it is, I'm like, ouch, right there. So, and administering the Narcan, putting it in the nose and administering that. If they don't wake up, administering rescue breathing, and if possible, immediately calling for help, of course. And you can administer another dose within 3 to 5 minutes if someone doesn't wake up. If they do wake up, the instructions indicate putting them in a rescue position, so rolling them onto their side, so if they were to vomit, they don't choke on their own vomit. But all of those are ideal setting steps, and we know that in a crisis, the most important thing is that we can get this Narcan up someone's nose to help with those brain receptors and reverse that overdose.
Samantha, thank you so much for being with us, walking us through this, and we appreciate all your information.
No problem. Thanks for having me.
Thank you. Narcan is now more accessible to individuals, but it's been utilized in the community for years to combat the opioid crisis. Here to clarify the importance of simple access to Narcan is Nathan Boyette, president of Boyette Treatment Services. Thank you so much for being here.
Thank you.
So how important has Narcan been in the treatment of opioid overdoses?
It's really important in terms of prevention of overdose deaths. We know overdoses are going to happen due to the fact that fentanyl's just flooded the whole drug supply in the area. So pretty much we kind of look at it as all the harder drugs have been contaminated with fentanyl. You know, the heroin's not real heroin anymore, it's just straight fentanyl, and the fentanyl's in the cocaine, it's in the methamphetamine. So it's really important to kind of get Narcan out to as many people as possible, not just people that are active use, but people that are maybe family members or co-workers or anybody. It's important for everybody to kind of wrap their heads around the fact that we should all carry Narcan, in my opinion.
So fentanyl in itself is very, very potent and can be deadly as well. Any background as to why this is now being added to these drugs and why that's become so prevalent? And does that presence in these drugs change how Narcan and how you treat overdoses? Narcan's
very effective against fentanyl. Sometimes it takes multiple doses. It just depends on what kind of fentanyl it is, because there's several different kinds now. Some are stronger than others, but it does absolutely reverse somebody from dying. Because they stop breathing pretty much, or they get real shallow breathing, and then they end up dying. And the Narcan basically kicks all that stuff out of their body, basically.
Wow. So is it currently really difficult for people to get a prescription for Narcan or to get their hands on Narcan if they need it?
Not in this community, no. I mean, if you ask your healthcare provider, they should be willing to send that into a pharmacy for you. And pretty much, like I'd say, probably about 99% of all people with insurance, it's covered. So their insurance will cover it. And even for people that don't have insurance, there are multiple Narcan distribution points throughout the city. Like at my facility, there's one, and there's several other. I know there's one like at Lamasco's, there's one down there on Franklin Street, there's one at the Evansville Treatment Center, the methadone clinic. They have it out there, and they're all readily accessible. Like at my place, it's 24/7. It's on the outside of the building, so they can come up and grab a dose of Narcan and not have to actually talk to anybody.
Interesting. So there's no danger in terms of administering this dose. If you're with someone and you see or you come upon someone who's had an opioid, they're experiencing an opioid overdose, this is not a dangerous thing for you to use to try and help reverse.
Absolutely not. No, it's very safe. It's very effective. If you gave it to somebody that wasn't having an opioid overdose, it wouldn't harm them whatsoever. It's approved for children even. Not that it's used very much in that regard, but if it needs to be, it can be. So in terms of safety and efficiency, it's extremely effective.
So in your opinion, would providing easier access for Narcan, just like you're doing at some of these locations, would that help prevent some of the overdose deaths that we're seeing throughout the entire country?
Yeah, absolutely. And I think that's why there is this big push to, make it readily available. Number one, to get it into more people's hands so that we can have more chances to reverse those overdoses and prevent the deaths. And also, I feel like the more we make it available, the less stigma there will be surrounding it.
Sure. Well, let's talk a little bit about that stigma, because when you talk about possibly calling your healthcare provider or insurance covering it or going to some of these locations, people might be kind of full of shame or reticence or be embarrassed, those types of things, to request something like this. How do you help people overcome that, whether it's for you yourself or for a friend or a family member?
That's why we have them on the outside of the buildings, and they don't have to come in and talk to me. Like, we have it available in my facility, so they can come in and just talk to us if they want to, but it's also available on the outside of the facility, so they can just come and get it with no judgment, no shame whatsoever. They're just able to come grab a dose and not have to worry about anybody looking at them and judging them or saying anything.
So once someone has experienced something like this, what should people do in terms of helping? It's kind of the quick fix at the time, but what can someone do to help get them into either recovery or help put them on a path to where they might not experience this in the future?
Well, hopefully if somebody has an overdose and they live through it, maybe that's the breaking point for them to kind of get into treatment. Mm-hmm. And I think the most important thing for them is to reach out for help, just not immediately go back to the old behaviors, as they call it.
Sure.
So, and there's plenty of help in this community. I mean, there's my facility and there's numerous other facilities, whether it be Stepping Stone, Deaconess Crosspoint, Brentwood, Clean Slate. There's lots of facilities in this area. So I feel like we do have readily accessible treatment in this area.
Do you find that that's the turning point for some people who have gone through an overdose?
Oh,
if
yeah.
they've had to be revived with Narcan, that is kind of hitting their rock bottom?
Yeah, absolutely. I mean, if you almost die, you're pretty much right there. It's definitely a big wake-up call. It's a big reality check that they're not playing, that they're not invincible anymore. That this can kill them and it will kill them.
So just from our conversation, would you encourage someone to keep a dose of Narcan if you know someone who's struggling with addiction or drug use? Should people keep this readily available at their home or businesses or things like that?
I think everybody should have Narcan on them, whether they just throw it in their glove box or throw it in your purse or throw it in your gym bag, just to have it. I mean, because you're more likely to run into somebody that has an overdose than you are to actually find somebody choking in a restaurant and need the Heimlich maneuver. Statistically, you're more likely to run into a situation like that than you are other situations. So I think it's important just for everybody to have it, because the more people to have it, the more opportunities there will be to reverse those overdoses.
So we were just talking about this now becoming more readily available, and we were talking about the potential process. So when do you feel like this will hit the shelves? What are some of the process on it getting to the shelves, and what's one of the questions you have in terms of how accessible this will be to people?
I'm really happy that they made it over the counter available, and that it's going to be readily accessible to anybody that wants to go into a pharmacy and get it, because not every community has the distribution points like we have here in Evansville. So, nationwide, it will absolutely increase access to this life-saving medication. I think right now the main outlier is just the cost. I mean, that's what it's going to come down to. Is it going to be affordable, $30, $35, or is it going to be kind of outside some people's range at $85, $90? So who knows at this point? That's the big kind of question around it.
So that could be a real challenge for people who might be low income or those types of things that they might not have access due to price point.
Absolutely, absolutely, that could be a barrier. But regardless, it's more accessible to everybody. So I think that's the main thing that they're pushing for, is just to try to get it into many people's hands and accessible as possible.
All right. Well, Nathan Boyette with Boyette Treatment Center, thank you so very much for all of your important information.
All right, thank you.
Thanks for joining us to learn more about how the distribution of Narcan over the counter has the potential to prevent more fatal opioid overdoses in our area. Next week, we'll be talking with Indiana Governor Eric Holcomb about a variety of topics. Thanks for watching WNIN Newsmakers.